Patients going through serious illness, maybe life-limiting or life-threatening, they need all the support that they can get. Apart from the medical care which is provided by their primary care team and also maybe palliative care team, they need a lot of family support and community support. The important difference between palliative care and hospice care is that most of the palliative care is actually delivered at different settings by the healthcare teams, where the role of the family caregivers or volunteers may not be much. But towards the last 6 months of their lives, what we call a hospice care now, more or less the last few months of care, the importance of family caregivers, volunteers and social workers becomes very, very important. So the next question is the competencies or the skills that are required by the family or even informal caregivers to look after these patients who are going through the most vulnerable period of their life. The first and foremost thing is, particularly the family caregiver, they should have a decent understanding about the disease and also the possible consequences, outcomes. Only when the prognosis is known, the possible trajectory of the illness is known by the family members, they can do the advanced planning, which is very, very important. When I say advanced planning, we actually try to foresee events, what trajectory this illness is likely to take, and what are the problems or complications or consequences that can be expected. That may or may not materialize, but there is likelihood of these things happening. To give you an example, a patient with carcinoma esophagus, at some stage of the disease, may find it difficult to swallow liquids or solids. Then what should be done in such an eventuality? Likewise, a patient with a carcinoma lung is likely to experience shortness of breath at some point of the illness. So what is to be done at such an instance? Whether we make arrangement for an oxygen concentrator or maybe an oxygen cylinder, or should we go for a tracheostomy? So these are things which cannot be decided when these things actually happen. We need advanced preparation. It's also very, very important to understand, to discuss the preferences, the values and the wishes of the patient. Many times an 80-year-old patient may wish that he doesn't want to get admitted in ICU if his condition deteriorates. Unless we discuss these things with the patient beforehand, it will make our decision making very, very difficult when these things actually happen. So the patient's preferences are very, very important. Very important decisions regarding resuscitation, mechanical ventilation, intubation, hospital admission, ICU admission, these things can be foreseen and can be discussed at a proper time in a proper manner with the patient and his wishes known, so that if and when these things happen, it will be easier for the family to follow this care plan. The family also should acquire the needed skills to take care of patient in terms of skin care, mouth care, bladder care and bowel care. These things have become very important as the patient become dependent and bedbound. Likewise, medication management and nutrition management are two modalities where it's very important for the family members how to change the consistency of the food, how to, when the patient is unable to take good quantity of food, how best we can give him nutritious food within the limits of his ability to swallow and all that. So these things the family should acquire or learn the necessary skills and knowledge through reading, maybe through speaking to the health professionals, or even getting to know where and how these services can be obtained in time of need. So these are the very important requirements for the caregivers to prepare for what may happen.